Let's take a look at Station 1, the Therapeutic Exercise Station. In this station, you'll be completing 5 tasks total. 3 where you'll be teaching your client exercises they can do at home, and 2 where you'll be working together with your client in the room. All the equipment and materials you need will be provided, and you can complete the tasks in any order. You already have consent. Before we get into the tasks, the most common mistakes in this station are that students will often cover everything in one go at the start, one big explanation that tries to apply to all 5 tasks at once. Don't do that. The examiners want to see that you understand the purpose and specific considerations for each exercise individually. Go through the key points separately for each task. We'll look at those points right now. One more thing before we start. It's important to know the difference between contraindications and side effects. The STEM will likely tell you that there are no contraindications present, so you don't need to screen for those. What you do want to mention for each exercise are the expected side effects, things like muscle soreness the next day, so that your client knows that what's normal and isn't alarmed. That's what we mean when we talk about risks in this station. Your first task is to teach and demonstrate an isometric exercise for one of your client's muscles. Start with a brief explanation of what an isometric exercise is. A contraction where the muscle works but the joint doesn't move. Show them where they'll feel it, explain the general benefits of this type of exercise, and mention the expected side effects. For example, that they might feel some muscle soreness the next day, and that's normal. Let them know to stop if they feel any pain. One thing students forget here is remind your clients to breathe. Holding your breath during an isometric contraction raises blood pressure and is something examiners will notice if it's missing and you don't address it. Demonstrate the exercise yourself. Give them the frequency, the sets, the reps that you want them to follow at home. It's also worth giving a brief progression cue, something like, if this starts to feel easy after a week or 2, you can increase the hold time or add some light resistance. This shows the examiner that you understand the rehabilitation process and not just a single exercise. Have them perform it for you. If they do it incorrect, correct them, but watch for 2 things: their form and whether they're feeling it in the right place. Both of these things matter. Finish by asking them if they have any questions and whether or not they feel comfortable doing this on their own at home. Task number 2 is an isotonic exercise. Your second task is to teach and demonstrate an isotonic exercise for one of the client's muscles. The same structure as isometric. Start with a brief explanation of what isotonic means, a contraction where the muscle works through the range of motion. Show them where they'll feel it, the general benefits, the expected side effects, and stop if there's any pain. For breathing, cue them to exhale on the effort, the concentric phase, and inhale as they lower it. This is the natural breathing pattern for isotonic exercise and is worth stating explicitly rather than leaving it just to chance. Demonstrate the exercise. Again, sets, reps, frequency. Give a brief progression. For instance, increase the resistance or the reps. Have them show you. Watch their form and whether they're loading the right muscle. Correct them if you need to. Ask them if they have any questions and whether they're comfortable to do that at home. The third task will be a stretch for your client to do on their own. Explain the general benefits of stretching, so improved flexibility, reduced tension, better range of motion. Show them where they'll feel it. Mention that they may feel some mild discomfort during the stretch and some residual tenderness afterwards, and that's normal as long as it fades quickly, but to stop if there's any pain. When you demonstrate, include 2 safety points that most students commonly miss. First, there should be no bouncing. They should hold the stretch steadily. Ballistic stretching increases the risk of injury, and your client needs to know this before they go home and do it unsupervised. The second thing is make sure that they breathe into the stretch. Exhaling during the holding helps the muscle relax and deepens the stretch. Tell them how long to hold it and how often to hold it. For progression, a simple cue like, as this gets easier and your flexibility improves, you can go a little farther or hold it a little longer. Ask them to perform the stretch, correct their form if you need to, and make sure they're feeling it in the right muscle. Again, ask them if they have any questions and if they feel comfortable doing this at home. The fourth task is a range of motion exercise. You want to be performing this with your clients. For the range of motion exercise, explaining the general benefits, maintaining or improving joint mobility, reducing joint stiffness, promoting circulation. Mention the risks, like some mild discomfort during the movement is possible, and let them know that they should let you know and stop if there's any pain. Before you begin, check in with your client, confirm that they're comfortable and ready to start. This is a small step that students usually skip with the hands-on tasks, and it matters to make sure that your client care is good. Once you start, cue them to breathe naturally throughout the movement and not to hold their breath. Take them through the movement 5 to 10 times, checking in on their comfort, and ask if they have any questions when you're done. Your final task is going to be a PNF stretch. It's most likely going to be a hold relax, but it's possible that the stem may specify agonist contract, so read it carefully. A quick clarification on the difference. Hold relax means the client contracts the muscle being stretched against your resistance, and agonist contract means they contract the opposite muscle instead. It's the same sequence, just different muscles doing the work. Explain what you're going to do. List the general benefits of PNF stretching and what they might feel afterwards, as well as some risks. Again, residual muscle soreness or fatigue. Stop if there's any pain. As with the range of motion exercise, confirm your client's comfort before you start. Then walk them through it. Place them in the initial stretch and hold it for 15 to 30 seconds, asking them to breathe into the stretch and not hold their breath. Then ask them to contract the correct muscle against your resistance for 6 seconds. Then move them into the final stretch and hold for 15 to 30 seconds again, continuing to check their comfort, and when you're done, ask if they have any questions. For exam purposes, you only need to perform 1 cycle. You don't need to repeat it 3 times as you would in a real treatment situation. And that's it for Station 1. 5 tasks, a clear structure for each one, individual coverage for every exercise, and nothing said in bulk that should be said for each exercise.